Looks like Joe. Joe's on vacation.
Hi, I think we have an introduction next first.
This is what it's the Regional EMS Council New York City meeting for November 28, 2017. Let me do roll call vote first, then introduce.
Sure.
Please answer when I call your name. Dov Jacob. Deputy Chief Christopher Bills.
Present. Chief.
Did I pronounce that right? Because my pronunciation is legendary.
Bills is correct, yes, thank you.
Chief Christina Zola.
Present.
Patrick Myers.
Present.
Dominic Battinelli.
Present.
And William Goffin is here too. Joseph Marcelino.
Present.
Danny Mizell. Mordecai Goldfeder. Robert Bristol.
Present.
Detective John Johnstone.
Present.
Martin Grillo.
Present.
Brenda Morrissey.
Present.
Joseph Schenker.
I am here.
Okay. Scott Orlansky.
Here.
Mordecai Lax.
Present.
Vincent Barranco.
Present.
Scott Chang.
Here.
Robert Krupe.
Here.
Joseph DiMurato.
Here.
Manfred Fuchs.
Here.
Gerald Gelbard. Jerry Gumbo. John Graves.
Here.
Dennis Laurie.
Here.
Mitchell Powell.
Here.
Michael Batch. Okay, we have a quorum. I'm going to send around the attendance list. And before we get started, we have a guest tonight from the United Kingdom. Rebecca Reeves from New Scotland Yard. I don't remember your rank.
Detective Chief Inspector from the Met Police in London.
Welcome to our meeting. Detective Reeves is here to get experience at EMS. So all of you that have ambulances, that are paramedics, that would allow her to participate, and observe, it would be a great addition to her trip.
Thank
We
you
also
very
have
much.
representatives here from New York City OEM. So I don't know if you've met with them yet.
No, I haven't yet.
There's a rep here, Robert Bristol. You all can talk afterwards and have some wine and some cookies.
Thank you very much. I'm really pleased to the committee and to the chair for allowing me to sit in as an observer this evening. So just if you have any questions, and likewise I'd like to speak to people, please come speak to me, and my contact details are also available through the Secretariat. Thank you very much.
Thank you.
All right, so if you review the minutes for October 24, 2017 meeting, is there any questions about that? Do we have a motion to approve? Second?
Second.
All in favor? Correspondence report.
Okay. We received a few requests to be excused. I remember James Downey. We received a few others before I was running down here, but they'll be in next month's minutes. I received a resume from a Shabina Hirani. I'm not really sure why she sent in the resume. I'm not sure if she wants to be a member of council or if she was looking for employment. I'll be contacting her to find out. Nothing from fire departments, from New York State DOH, email from Gene Taylor stating that our determination regarding emergency aid training could be done at this meeting, November 28th. I wanted to make sure we were okay with the 45 days. Public notice from New York State Department of Health. The following two EMTs or paramedics had their certifications revoked because they responded to a call, provided patient care, or driven an ambulance under the influence of something. And I'm noticing that we're getting more of these. The providers are Gregory Monsky, Vincent Ilardi. Gregory is from Shirley, and Vincent Ilardi is from Holtzville. Letter from emergency aid training to the QA committee, and they were responding to our request for additional information regarding need. We received an application for determination of public need from Ezra's Nashim, which we will hear about in the ambulance committee report. We sent out agendas, minutes, and other information for this meeting, including the nominating committee report, which will be having elections later. And also, we sent to ambulance committee the entire Ezra's Nashim application for their review. That's it.
Okay. So election of at-large members, this will talk about the nominating committee.
Okay.
So the nominating committee, the Regional Mass Council of New York City, okay, met on Monday, November 6th, okay, 5 o'clock. The nominating committee members were Dominic Batinelli, Joseph Marcelino, okay, Mike Raiola, okay, Marvin Braidman, Ren Giordano, okay, and Michael Jones. The following 3 nominees were recommended to KK for appointment as an at-large member beginning January 1st, 2018. And those people are Arthur Cooper, Yvia Langson, KK, and Joseph Scarpino. There are 2 seats available. KK for REMSCO members must vote to select which of the 2 nominees will be appointed.
Okay, I have ballots here. I don't know if there's discussion before we send around the ballots.
You all good?
Okay. Well, there's a bunch of blank pages in here too, so. Pass me around. So only pick 2 from this list. Lots of blank pages. Move right on. Yeah, we can definitely
All right,
continue.
so it doesn't go around, if you just,
And then we'll have another
Select-
committee member.
2
actually
appointees, and just fold it, and we'll come get it, and we'll count them up. Meanwhile, let's just get on with the rest of the meeting. Okay, so we're gonna go to, staff reports.
Yeah. Yeah. If you want to, yeah, pass them on.
Have to not like.
Want the extras?
Yeah, I'll take the stuffings.
Yes, you can
Take
go
the
on
stuff
to
in.
the ambulance.
Okay, so, what are you gonna do? Oh, let's just reports and
Yes. Okay. Only members of REMSCO can vote. I'm going to count if you have more ballots. Then we'll have to,
Want to stay in order? Step report. Okay, so we have emergency preparedness, okay.
do you want to give an emergency service update now, Nancy?
You want to wait?
No, I can do it now, while they're voting, is that what
Yeah,
we're
yeah,
doing?
yeah.
In between? Sure, we could save time. Problemo. So, REMSCO has, I have been attending, HIDA monthly RX meetings. Those are meetings for the high-intensity drug trafficking agency, studying, ways in order to help the overdose crisis. And we're reporting the data from the PCRs. We submit that data to the City Department of Health, and they've been reviewing that, City and State Department of Health. Because we do that, we also get, that's how we get our free Narcan. So, one hand washes the other. So we are providing that data, and hopefully at some point, that information will be announced where we can do something collaboratively with the city and state and federal agencies that we're partnering with. They, HIDA have invited me to attend the Atlanta conference, a summit, to discuss this issue, and it was in conjunction with CDC, so it's important to know that we are continuing that relationship with HIDA and with all of these agencies in order to accomplish a goal and to try and deal with this major crisis that's occurring. Additionally, we are involved with OEM in terms of their weather advisories and any other meetings that occur. Do believe that one is being held for mapping next week. We participate in the Greater New York Coordinating Council meetings and several hospital coalitions, so that we are working on advisories for, we did last year, approval for the dialysis centers, what to do and what not to do during an emergency, who to call, do not show up in hospitals, that type of information. We are doing the same thing for methadone clinics now. That's part of the coalition deliverables. So we are focusing in on the transportation end of what occurs during all hazards. By the way, our payments for program agency and regional council, I was a little concerned because Lee Burns is leaving and everybody's getting shuffled. But actually, we're not having any issues. All payments are being made, so I'm very pleased to hear that. Yeah. And we do have a reminder that anyone who needs the Narcan, since it's in the spray, which is the 4 milliliters, I simply need the medical director's approval or statement that they approve it. So a simple email will suffice, and then I can pass that Narcan on to whomever needs it at the agency level. Blood glucometry was distributed. I'm reminding our volunteers to consider the limited lab licensing that needs to occur, and check with your district leaders to see whether or not you can function under an umbrella that may be occurring. And then the final piece is that I'm sure many of you heard, and you certainly probably read my memo that I sent out to you regarding the American Heart Association and the layperson CPR certification cards. They were increasing those cards from, in terms of a cost, from $2.50 to $17, which creates quite a burden for the layperson. This is strictly lay professional now. We have in the past, as I said in my memo, that we have developed our own cards. We function under the guidelines of the Emergency Cardiac Care Committee, as well as the protocols which are utilized under and approved by REMAC. So I am presenting that information to the Regional Council. I have already, our Board of Directors has approved that. REMAC is supporting it, and this is we're asking for your support as well. So this way we have the support of our Regional EMS Council. The cards will be provided to the layperson at $6 a piece, and we will have the manual on web when it gets finished at no cost, and certainly it'll be open source for them. So we thought that that would be a good way for us to help our instructors who do teach courses for the layperson.
Very good. Any discussion, questions? Okay. Program agency update.
That is all of
That's
everything. I gave you
all of
everything
wow,
all
wow,
across.
unbelievable.
I did it, 1, 2,
How do you
3.
do that? That's amazing.
Yeah.
That's so cool. Wow.
So, but
I
I would
should
like,
know.
I would, thank you. I would like a verbal support from the regional council regarding our cards.
Ambulance committee.
We'd like to have some kind of support from the regional
Oh,
council.
okay. So.
Support.
Give me a motion.
I make a motion to support the regional council.
Second.
There you go.
Hand vote, all in favor?
Thank you.
Thank you. Blank ballot.
Didn't you get help with that?
Oh, I gave Morty my last blank ballot.
I'll write it down for you.
Here's one right here.
Oh, here's a ballot. Who needs a ballot?
Michael Batson. Blake guy, yeah. You can sign in here too.
I'm gonna recount this. I'll recount what I have in the meantime.
Mr. Marcelino.
Oh, the ambulance committee report?
The ambulance committee met immediately prior to the REMSCO meeting. There was a review of the correspondence report, which you already heard. You've also been a review also of the emergency preparedness update, which Nancy just gave us. There was no new public access defibrillation notifications. There was no new ambulance committee tag reports. There's no new unfinished business. We did review a new application for determination of public need. The name of the organization, I apologize, I don't want to pronounce this incorrectly.
Ezra Snashin.
It was deemed by the ambulance committee that the evaluation of the application's completeness, but the application is incomplete, and would be returned back to the applicants for further review. That concludes the ambulance committee report.
Discussion, questions?
Can you pass this on down to Morty?
Okay, so Training and education?
Didn't meet. Did not meet.
Okay.
And our next meeting is scheduled for January 9th. And hopefully we can do some work over the holidays.
Training and education, Maureen?
Didn't meet.
Training and education?
Yeah, we didn't meet, so the
No, I
next
didn't know.
meeting is,
No, we didn't.
yeah,
When's next meeting?
it's January 8th, January 9th.
Okay, so regional emergency medical advisory report?
So the Regional Emergency Medical Advisory Committee met on November 14th. I will give you the summary of what we discussed. There were a few approved motions. Thank you very much. The first approved motion was that in New York City pediatric trauma centers, so patients that are pediatric trauma patients should be transported from the field to a level 1 or level 2 pediatric trauma center if they meet the CDC field triage guidelines and are able to arrive within 30 minutes of transport. So 30 minutes is the number that we agreed on from the time you pick up the patient to the time you arrive at the hospital, even if you have to bypass an adult facility. We made changes to protocols 513, 521, and 530, specifically due to the shortage of diazepam. So midazolam IV dosing has been added as an emergency change. In 530, there were some typographical errors that were corrected. The fluid bolus dosing in 528 was clarified. Okay, the use of a hemostatic dressing was approved, and an advisory is being developed. And REMAC also supported the REMSCO CPR course to be developed for the non-professional rescuer. And the next REMAC meeting will be on January 23rd, 2018. Thank you.
Thank you. I just have a motion to accept the report. First, motion.
Second.
All in favor? Okay, so, quality improvement committee report, Michael?
Did I read?
I am.
Oh, there you are.
Oh, great.
Everybody, hello. I'm Michael Redliner. I'm the chair of the Quality and Safety Committee for the REMAC and Regional Council. This is my first time coming and presenting to you guys, so I appreciate the opportunity to do so. I'd like to tell you about our committee. We met on November 8th in 2017. We are currently involved in several ongoing QA studies. One is the midazolam study. This is actually was presented in the spring of this year, but because of issues and problems with the REMSCO website, we've delayed it. You should be getting notification that we'll be asking for some for a questionnaire to be filled out related to midazolam use in the excited delirium protocol. We're also working on a safety study around fatigue, which I'm suffering from right now. And we're working on quality improvement projects related to the mobile stroke unit in New York City. One of the things that, for the first time in some time, this is the first time that the QA committee is looking at course sponsor training applications. We received 2 requests for expansion. Or for new course sponsors. One is an expansion request from the Emergency Aid Training Company, and it was the application was for an expansion into Kings County. They are currently working in the Bronx and Manhattan, and we received the application from the state, who deemed it to be complete. And we were asked to review for its impact. I guess the REMSCO's role is really to evaluate whether it will have a negative impact on the current or existing, or if there's a need for new sponsors in a particular borough or region. We had let me just mention that the other application was from Emergency Medical Education Services. This was for an application for a 5-borough BLS training center application. And in both cases, after having a long discussion about how you determine need in New York City, we went back and forth. There was a lot of back and forth about how you determine need. There was some discussion around difficulty finding courses to take if you're refreshing or if you're finding a new, if you're becoming a new paramedic or EMT, because the enrollment in these courses is difficult to fill. And so there was some argument around making sure that there's not too many courses so that there's enough students to have enrollment in all of this, in all of the courses that do currently exist. The other side of the argument was looking, it's kind of a new argument to put forward, which was a population-based assessment. So we talked about whether or not new training centers should be based on the population of a specific borough. And if you look at the number of people who live in a borough and the number of training programs, our ratio are pretty low compared to the rest of the state. And so, for example, in the Bronx, there's one training center for every 132,000 plus people. In Brooklyn, it's one for every 164,000 people. Manhattan, one for every 126,000, et cetera. So in other places, it's down to one for every 32,000 people. So this argument was put forward as a reason to accept new training centers. But what I would say, the discussion, and neither of these programs were recommended for approval from the Quality Improvement Council. The vote was 1 in favor, 2 against, and 1 abstention for the EAT program, and 1 in favor, 2 against, and 2 abstentions for the Emergency Medical Education Services. So with that, I'll turn it over to you guys.
Okay, so you have some discussion on this? And we'll have to, make a decision ourselves as a body, to vote on it and keep the, but is,
You also have representatives
Yeah.
from the training centers here, and if you want to give them an
Sure.
opportunity.
Sure.
So just, may I interrupt
Yeah.
for 1 minute? This is a statutory function of the regional council to either approve or deny course sponsors. So just so that you know, this is something that you need to address on some level.
How you doing? Kevin Mahoney, Emergency Aid Training Course Sponsor Administrator. We started Emergency Aid Training in 2008. I went through a 2-year process to get approved from this body and worked for a few years and then expanded into Manhattan, and we were approved in 2014. Our theory was to try to establish ourselves as a company, a training company, provide quality training. Currently have a 93% pass rate on first-timers, 97% pass rate on second-timers. Run programs at Fordham University, John Jay, and Hostos Community College. We do have a relationship and a potential opportunity to work in Kings County. Since 2014, there have been 2 sponsorships that have been closed, with TransCare and Presbyterian giving back their course sponsorship that hasn't been replaced. So we just, thank everybody for the work that they do, and just requesting this body's approval for our expansion into Kings County.
any questions while you're standing? Okay, thank you. Any further discussion before we have a vote? Eliza?
I can't vote yet, I don't know who.
Okay. You always have an opinion.
That was good. That was good.
Nice rebuttal.
But I'm gonna use my opportunity of not yet knowing the vote, so I don't have to vote.
All right, so if there's no further discussion, then
Okay, I'll do a roll call vote. Just let me know yes, no, abstain.
So we're
Yes.
voting
Do you vote?
for what?
What's the
Emergency aid training wishes to expand into Kings County. They currently operate in Bronx and Manhattan.
Right.
They are BLS training
Okay.
centers.
So
the seconded motion that came forward from QA was no in both cases. So we're voting to to agree to that, or are we voting to? Is it just a straight up vote and the opinion of QA
The
has
QA
no?
committee was more split on,
No, you can't report it that way. There was a vote from the QA, okay? That comes in seconded motion to hear.
My
Now, we
understanding
can
is
vote
that,
that up or down.
right, so my understanding is that the QA committee was tasked by this committee to evaluate, do an assessment of need when we're doing these expansions. It used to be a training and education responsibility. It was moved to QA for the reasons that it was moved about a year and a half ago. So the seconded motion from QA was a no in both cases. Are we voting on kind of agreeing with that? Or are we voting straight up, do we approve or disagree?
No, that's the motion, there's a motion in front of this
So
body
there's a
right
motion.
now,
Seconded.
and that's the motion
Perfect.
that
Then
came
that's-
from the committee.
Right, which was,
Dr. Redlener, can you
Yeah.
just repeat
Sure.
what it was?
So the vote from the committee was not to approve in both cases.
okay,
So that's the motion.
so that's what we're voting for. So if you say yes, then you're not approving. If you say no, you are approving. Correct?
That is correct.
We're all on the same page. Good.
If you vote yes, then it's not approved.
That's what I said.
But then you can have another motion from here to approve. In other words, there's nothing that stops this committee from introducing its own motion. Right now, the only motion on the floor is the one from the committee. Now, you can make a motion to substitute a different motion for that motion, it requires a 2/3 vote. But since I think that's more complicated, first vote on this motion. Vote yes, and then it'll be no. It'll be yes on the motion is to disapprove, and vote no, and then if you want, you can put in another motion.
Does anybody have aspirin?
I have.
Let's just,
So make a motion to uphold the recommendation.
A yes vote now approves the committee's
Recommendation.
motion not to approve.
Okay.
Not very technical. Some of us have PhDs.
Make sure everyone's very clear on this.
Yeah,
A yes is no and a no is yes.
right.
Only in this particular set of circumstances.
Right. No, I agree.
Now you're making fun of me.
Yes, we are.
That's twice in one night.
Listen,
Remember, he hasn't been elected.
And this is on video. Just kidding. Sorry.
Motion to amend it, not an amendment. That overturns that motion, so it will have to be voted. An amendment makes a little change, but it doesn't negate the whole motion. So this is yes or no, it's just simple.
okay.
So vote yes if you do not want to approve.
are we doing this separately?
Yes.
Each one has to be done separately.
Okay.
Okay, so right now,
Do we all understand this?
quality, seconded motion from QA is not to approve the expansion of emergency aid training into Kings County. So if you vote yes, you're voting to support QA, and it will not be approved. If you vote no, you're not supporting QA's decision, and we're approving. Okay. Doug Jacob.
Yes, I'm supporting the
Thank you. Clarifying.
Nicely done.
Chief William Bills. Yes, no, abstain.
Yes, Chris Bills.
Chris, what did I say?
Chief.
That's because his name is there twice.
You know, I have your name down as William.
That's Christopher. It's William now.
It could be William.
Voting on
Steve,
X.
Steve, how do you vote?
That's the next vote. The next vote is to change your name.
It's confusing enough. Okay. Yes, no, yes. Christine Mazzola?
Yes.
Patrick Myers?
No.
Dominic Battinelli?
Yes.
Joseph Marcelino?
Yes.
Robert Bristol?
Yes.
Detective John Johnstone?
Yeah.
Martin Grillo?
Yes, to support the committee.
Brenda Morrissey?
No.
Joseph Schenker?
Yes, in support of the committee.
Scott Olansky?
Yes. So this could end.
Mordecai Lax?
Yes.
Vincent Baranco?
No.
Scott Chang?
No.
Robert Krupe,
Yes.
Joseph DiMorato,
No.
Manfred Fuchs,
Yes.
Sean Graves,
No.
Dennis Laurie,
Yes.
Mitch Powell,
Yes.
Michael Vash.
Yes.
Give me a second so I can
Sure,
count.
Mr. Chair.
Dr. Cooper has a question.
Yeah.
Am I not a member? I thought I was.
Not yet.
Not yet.
Yeah.
We haven't announced. Voted on it.
Sorry.
We gotta vote on it.
Next meeting.
Okay, we have 16 in favor of upholding QA's decision, 6 in the negative. So the motion from the QA committee carries. Okay, so on to the next one.
Okay, so before we go on to the next one, we go back a second to red members.
Okay,
Since Dr. Cooper seems very curious.
No, you can't do that. No, you gotta stay, you can't do that.
I'll bet.
You can't vote.
State EMS council report.
no, we have another,
Next vote.
we have another vote. We have a,
The other,
Oh,
The other
yeah,
agency.
sorry, it's the, next one is, oh my God. It's a 5-county BLS training center from Fred Nitel, Emergency Medical Educational Services. It's a new BLS training center from, is Fred here?
Yes, I am.
Fred's here, and he could, if you want to, to address the council. This is a new training center for 5 boroughs.
So Fred Nitel, appearing before the committee, I appreciate your time. I am seeking course sponsorship. I'm in a unique position because I'm the administrator of a particular ambulance. It's a volunteer organization. It's unique. Part of the City University of New York, Brooklyn College. It is the only city university to have a volunteer EMS ambulance on campus that provides service for the community and the immediate surrounding. It has been increasingly difficult on campus to recruit new members. There's a lack of EMTs on campus, and since I identified that need, being the administrator of the service, I thought that it would highly benefit the campus and the organization if we were able to teach EMT courses on campus. I've been in contact with other city colleges that would like to have the same model that Brooklyn College has. So I thought that it would be a good opportunity potentially to expand that into the other colleges as well. So that's part of the reason for my 5-borough license, or my request for a 5-borough sponsorship. If the committee has any other questions for me, I'll be more than glad to address them to the best of my ability. Thank you for your time.
pose 2 questions to you. One, is Brooklyn College giving college credit for this when they were doing?
They were about 20 years ago. They no longer offer the class. The professor who taught that class has since retired. So it's not offered for credit, and I would not be offering it for credit either.
So this would be a non-credit course?
It would be a non-credit course, yes.
But this is not a Brooklyn College
not a
application.
Brooklyn
No, it's not a Brooklyn College at all. It's just since I am
It's
the...
not a Brooklyn College course.
Correct.
It's a private group that he is putting together.
Correct.
Okay, it's not a Brooklyn College course. He's talked to people at Brooklyn College to attract students to his course, but it's not Brooklyn College, and Brooklyn College has nothing to do with it.
Just a second question, I'll open it up to the group. You know, Kingsborough Community College has a EMT and a paramedic program. Is that a credit or a non-credit course? Does anybody know?
It's a credited class.
Credit for associates.
It is credited.
Thank you.
Yes.
Once upon a time, many
Yep,
years
I know.
ago, Brooklyn College had a credit course. Leibowitz
Yeah, Howie
was the one who had the course sponsorship. It wasn't Brooklyn College's course sponsorship, even then, it was his personal one. But they agreed to give it for credit.
They gave the
He
credit.
left. No, the course doesn't even exist anymore.
Yeah.
Any other questions?
Can you just go over the findings again from the committee?
Sure. The motion to approve was 1 in favor, 2 against, and 2 abstentions. So it was not, it was recommended not to be approved. So again, no.
A no is a yes, and yes is a no.
Same thing.
So if there's no more discussion? Last call?
It's the same motion.
Same motion, a vote of yes, a is accepting the vote of no. A no is not to accept the recommendation, to say yes.
Okay. Dub Jacob,
Yes, I'm supporting the committee.
Chris Bills,
Yes.
Christine Mazzola,
Yes.
Patrick Myers,
No.
Dominic Battinelli,
Yes.
Joseph Marcelino,
Yes.
Robert Bristol,
Yes.
John Johnstone,
Yes.
Martin Grillo,
Yes, to support the committee.
Brendan Morrissey,
Yes.
Joseph Schenker.
Yes, that's me.
Scott Olansky,
Yes.
Morty Lax,
Yes.
Vincent Barranco,
Yes.
Scott Chang,
Yes.
Robert Krupe,
Yes.
Joseph DiMurato,
I just want to vote no. No.
Manfred Hughes. Did you say yes?
Yes.
Sean Graves,
No.
Dennis Laurie,
Yes.
Mitch Powell,
Yes.
Mike Batch.
Yes.